5 ways Gerd and heart palpitations go hand in hand, created by UPOlife. We all have experienced heart palpitations at some point in our lives because of extreme emotions such as stress, fear, and even happiness. Heart palpitations are rarely a sign of a more serious health issue, although that may be the case as well. Often, heart palpitations are linked to another common health issue, Gerd, which stands for gastroesophageal reflux disease. This condition causes acid and other stomach contents to move up the esophagus. Gerd can also be easily mistaken for heart palpitations. One of the reasons is that Gerd can cause tightness in the chest. Although heart palpitations can also cause chest tightness, this is not the same. Heart palpitations cause a characteristic fluttering sensation of the heart accompanied by a racing heart rate. Your heart may even skip or add a beat. However, such symptoms cannot be caused by Gerd. Although Gerd does not directly cause heart palpitations, certain factors contribute to both Gerd and heart palpitations occurrence at the same time. Here are 5 of those factors that you need to know about. 1. Bad eating habits. Speaking of Gerd, certain foods and drinks trigger its symptoms. For example, spicy food, alcohol, and caffeine intake. Coincidentally enough, alcohol and caffeine can also trigger heart palpitations, especially when they are introduced in excessive amounts. The reduced intake of caffeine and alcohol can reflect positively, relieving both Gerd and heart palpitation symptoms. 2. Obesity. It is thought that the excess belly fat is causing pressure on the stomach, hence causing Gerd. Research also shows that obese individuals have a 50% higher risk of one of the most common type arrhythmias called atrial fibrillation. Obese individuals who are experiencing a racing or fluttering heart are advised to consult their doctor right away. 3. Diabetes. Both type 1 and type 2 diabetes are considered to be risk factors for Gerd. In those with diabetes type 1, the risk comes from the nerve damage caused by inadequate glycemic control. While for people with diabetes type 2, the biggest risk factor for Gerd, and with that for heart palpitations as well, is obesity. It is also worth mentioning that diabetics with atrial fibrillation also have a lower quality of life. They are also exposed to a greater risk of death and hospitalization. Luckily, the risks seem to decrease once diabetes has been properly managed. 4. High blood pressure. There are several factors, such as alcohol consumption and obesity, that link Gerd and high blood pressure together. The good news is that the anti-acid drugs used to relieve Gerd could lower the high blood pressure as well. High blood pressure increases the risk of heart disease. In case it is high blood pressure that is causing Gerd, it can also contribute to heart disease at the same time, hence causing heart palpitations. 5. Medications used to treat heart problems. Other than alcohol, caffeine, and spicy foods, certain medications can also make your Gerd because of the irritation to the lining of the esophagus that they cause. Calcium channel blockers, angiotensin-converting enzyme inhibitors, and nitrates are some of these medications. All of them are commonly used to treat various heart issues and the heart palpitations that they may be causing. If you are using any of these medications and experience Gerd, do notify your doctor. There are some relief methods and other medications that you can try out as well. Conclusion. Gerd is a common digestive disorder that causes the stomach contents, especially acid, to move towards the esophagus. Unfortunately, Gerd can also be an indirect cause of a much more serious issue known as heart palpitations. Often, the factors that lead to Gerd also contribute to the development of heart palpitations. If you experience fluttering and a racing heartbeat, contact a doctor as soon as possible. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.